Hello, I'm Dr. Christopher Sletten. I'm the clinical director of the Mayo Clinic Comprehensive Pain Rehabilitation Center at the Mayo Clinic in Jacksonville, Florida. This morning I would like to share with you some insights and suggestions about working with those patients that you have that have difficult to manage symptoms, have chronic medical conditions that have limited their life and functioning, and give you perhaps some talking points to use in guiding them towards alternative treatments. In our program, which is a 3-week day treatment program, comprehensive, involving physical therapy, occupational therapy, behavioral health therapy, we are able to help individuals with a broad range of symptom complexes improve their functioning, decrease their impairments, enjoy a better quality of life, and reduce emotional distress. And I'll get into some of the reasons for that in the next several minutes. The very first point I'd like to make this morning is to share with you the difference in your thinking between an acute and a chronic problem. As we all know, with acute medical problems, there is often a cause that is known, the onset is often known, treatments work, tissue damage and symptoms often match up very nicely. And as we all know, our patients and the public and even ourselves expect that to be the case with most medical encounters. Unfortunately, when the problems have become chronic, it becomes longer lasting, the onset is less clear, sometimes we're not even sure why it becomes chronic, treatments stop working so well, and tissue damage and symptoms don't match up so well anymore. That's the population I want to speak about, because those are the folks that can be emotionally draining. They can take up time in your busy clinical day. They often experience frustration and dissatisfaction with the clinical encounter. And those are the kind of folks that we can definitely help with in our program. Another word before we dive into some of the specifics. Our name, the Pain Rehabilitation Program, is presently a bit of a misnomer. We actually are able to help individuals with a variety of chronic symptoms, some of which don't directly involve pain. We have individuals who might have more nausea or more fatigue or more balance issues. As I'll mention in a few minutes, we even have individuals that have movement difficulties and what are presently known as functional neurologic disorders. And so we're able to really effectively help a broad swath of patients, not just limited to chronic pain. So once the person has begun to develop chronic symptoms, as you may be aware, the present thinking is this issue of central sensitization, this concept that there's neuroplastic changes in both the peripheral and central nervous system that involve increased noxious stimuli coming in from the body, increased sensitization in the somatosensory cortex, and we also believe this can spread to the motor cortex, leading to motor output issues. But whatever the case, one of the ways I summarize for our patients is that over time, it's a louder message from the body and a more sensitive receiver in the brain, which leads to the fact that it takes less to hurt, more things cause the hurt, fewer things help the hurt, and the hurt lasts longer. With that, our patients and your patients experience increased frustration, increased limited physical capacity. We often see this pattern of what we call pushing and crashing, where they will feel somewhat better, engage in extra activity, stir up their symptoms, and then crash. Medication use might become an issue. Emotional distress might become an issue. Those are all factors that we address in our 3-week program. So to help you help your patients, I'm also going to leave you with a few thoughts on how to communicate this. And the way I've described this in the past is considering making the pivot. So when you or your patients are contemplating that this is perhaps more of a chronic issue where the usual treatments and interventions have become less effective, being willing to make that pivot to the discussion of this is perhaps a different medical management strategy. We maybe need to look more at rehabilitative services versus interventional services. Also, I think it's helpful in this discussion to move from reductionism to a more systemic approach. The idea that they may have specific medical maladies, there may be specific things going on in their body that we could identify, but really looking at this as a system that has been impacted across physical, emotional, behavioral, and chemical domains to varying degrees, but clearly the patient's lifestyle and quality of life and functioning has been impacted. The program itself, as I mentioned a minute ago, is a 3-week comprehensive program. Our patients are admitted as a hospital day patient. We pre-certify insurance ahead of time. Just for awareness, most commercial carriers pay for this service, as do the government payers. During the day, our patients have 3 episodes of physical therapy, stretching, cardio reconditioning, and whole body strengthening done on a very gradual basis. We don't focus just on broken body parts. We work on a whole body fitness program. They have daily experience with occupational therapy, looking at lifestyle management, time management, biofeedback. And then there's the behavioral health component that includes stress management, looking at things like sleep, relationships, quality of life, dealing with emotional distress states. By the end of our program, we have consistently found 40% reduction in symptoms on average a 50% improvement in physical fitness, and a quality of life and engagement in life in the 60% range. So this can have a very immediate effect, but also a long-lasting effect. Finally, in conclusion, we do also have a 20-minute video on YouTube under the Mayo Clinic YouTube site that describes central sensitization in more detail if you need to watch that or refer your patients to that. We would love to be able to work with your patients. We've had great success and have a very easy access mechanism that we will put on this video. Thank you.